For this presentation, I chose the topic of nurse-physician relationships, which I feel is a really important thing in healthcare. So for the learning objectives, at the end of the presentation, the learner will be able to recall 2 reasons nurse-physician relationships are valuable, explain 1 impact these relationships have on healthcare, and explain 1 impact these relationships have on society. So why are nurse-physician relationships important? As we all know, communication is a key factor in all relationships, especially in healthcare. Nurses and physicians make up the majority of healthcare, so their communication is essential when discussing patient care. Poor communication can lead to negative outcomes and even medication or patient errors. This can also lead to low retention rates. It's a very real issue in healthcare and ultimately needs to be addressed to improve the quality of care we are providing to our patients on a regular basis. So what is the influence that nurse-physician relationships have on nursing practice? Relationships between nurses and physicians are a direct indicator of quality of care being provided. Disrespectful behavior from physicians can negatively impact the environment being worked in. This ultimately impacts nurse retention and overall patient outcomes. Relationships must also have mutual trust to function correctly. This includes each person being accountable for their actions, being reliable, and being non-judgmental when discussing care. The healthcare caste system also cannot continue to be used. Nurses and physicians are equal in patient care and cannot think otherwise. I know recently I've had interactions with physicians where they are under the impression that they are above nursing, so they tend to disrespect the nursing on the unit, which is not a very good feeling for anyone. Also, to counteract this, facilities should be implementing methods to identify and handle disrespectful behavior. There are a variety of disciplinary actions that can be used. I know at LGH, if a physician is complained about, they are required to sit through a training course. So this is something they really don't like to do, so usually one time does it and they change their attitude. But once this disciplinary action is completed, people need to be continuously monitoring these individuals to assess if the discipline put into place was actually effective. If it's not effective, then something else needs to be done. So impact on healthcare. Nurse-physician relationships directly impact patient safety. If nurses are not comfortable discussing concerns with physicians, they tend to avoid it. So if you know that your patient needs an antibiotic or an imaging, but you don't want to call that physician in the middle of the night because you know he's going to scream and yell at you, you can tend to push it off for day shift, which can directly impact their condition. So patients can suffer and be at increased risks for harm when this happens. Also, when nurses are dissatisfied with their positions, they leave them, which leaves hospitals short-staffed, as many are now. So short staffing ultimately leads to decreased quality of care and more frequent errors. You're having more patient-to-nurse ratios, which honestly isn't safe. I know a lot of times now we're running 6 patients with 1 nurse and 1 aide to cover an entire floor. So we're not catching things as quickly as we should, and patients are really being neglected. So patient satisfaction because of this results in a decrease. In order to fix this issue, collaborative relationships need to be discovered between nurses and physicians. Just being able to work together and having a positive outlook and attitude can really improve everything, which can lead to better satisfaction and patient care. So the impact on society. When patients receive poor care, they are less likely to return. When they don't seek medical attention for their problems, their condition can worsen, which can ultimately lead to increased mortality rates. The same can be said when medical errors are being made. Patients know that these errors are being made, so they're not as likely to come back, at least to that facility. So to bring it all together, nurse-physician relationships are directly impacting patient care. If nurses are not comfortable voicing concerns, they often let them go, which can negatively impact a patient. Disrespectful behaviors by physicians can lead to poor nurse retention rates and satisfaction. And when nurses are dissatisfied, they leave their position, which leads to poor staffing and increased errors through increased patient-to-nurse ratios. When patients receive poor care, they are also less likely to return for care in the future, which can ultimately increase mortality rates. So as you can see, nurse-physician relationships have a significant importance, and they really hold true to patient care.